discharge?
With mortars, I think a lot of times what happens is they either misfire, they don't fire as quickly as they think they're going to, or they fire too quickly, or they don't go off at all, and then they bend over and look into what they're lighting off, and then the mortar goes off in their face. So I think it's really important to keep a safe distance and really leave the fireworks to the professionals.
So if you have an amputated finger, you don't want to worry about cleaning that finger off or anything like that. Just package it up, wrap it in some moist towels, place that into a plastic bag, and then place that on ice and get to medical attention immediately.
Hold it off.
With the sparklers, I think, it's a common misconception that sparklers are fine, it's just a few sparks and the kids can hold on to them and they'll be just fine. The problem with sparklers is they heat to up to 2,000 degrees Fahrenheit. So if that spark hits a child or they grab the sparkler, that is a 3rd-degree burn or a full thickness burn. So that can be life-changing.
If you have a burn injury, it's okay to put it under some room temperature water, cover that wound, and then seek medical attention immediately. You really want to avoid any ice to that area because it can actually cause more damage to the skin than the burn has already caused itself.
This can affect them for years to come emotionally. This time of year, a lot of people who have been burned or injured by fireworks don't want anything to do with fireworks. So it can be a very difficult time for them that really affects them across the lifespan, not just for that period of time when they're dealing with their injury.
There's a large volume that goes through the emergency department on a daily basis, but we've highlighted a couple of times throughout the year where we anticipate a little higher volume than normal. We've implemented a process called Fast Track, where there's a even deeper collaboration between the ED and the burn providers and the burn nurses. So we anticipate a little higher volume, and we're prepared to evaluate all those patients.